Medical Dilemma.
Welcome back to Medical Dilemma. Again, I would like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining with me for the third segment are my co-hosts, Dr. Teresita Sanchez and Attorney Sarah Jane Sugipan. Okay. And of course, we still have our guests, Dr. Estrada and Dr. Ko. Now, I'd like to first give the time to Dr. Estrada to finish his explanation of how colon cancer is treated. Okay, so from the point we were interrupted by the commercial break.
Most of the time, really, colon cancer is treated surgically. If it turns out to be on the late stage, then it may be treated with adjuvant treatment, like chemotherapy. Now, for rectal cancer, there's a difference in treatment. Since the rectum is an area where you want to have, it's very difficult to do surgery, you want to downsize the tumor or make the tumor shrink, then we may need to do adjuvant treatment like chemo and radiation before the surgery. So they go hand in hand. But the earlier the stage is, the still surgery is the number one form of treatment.
I see. Now, what would you recommend to a patient suffering from colon cancer if, let's say, the patient is doubtful of having surgery? How would you counsel the patient?
Well, I always tell the patients, if they're still in doubt with the explanation of their physician, it's best to have a second opinion and try to look for somebody who is an authority on it. There are many surgeons we have in the Philippines that can help the patient. So it's just a matter of finding the right person to give them the right opinion.
I see. Attorney Sarah, earlier you had the question about using the microwave.
Yeah, about causes of cancer. Kasi sabi nga ni Doc no first segment, it's really lifestyle, di ba, no, Doc?
Well,
there are a lot of reasons, but one of them...
I always tell the patients with any cancer, it's three. One is genetic. The other thing is environmental. And the other one is OGK. Only God knows.
Only God knows.
But specifically, what are possible causes? Because we have heard rumors that using the microwave sometimes would not be good for the food that's there.
Well, there are what we call microwave safe containers.
Okay. What's
so
the
that means that microwave unsafe containers can melt, due to the microwave, or can produce when you put it in the microwave, they can produce some chemicals that can cause any disease, not only cancer. So it's best not to use containers that are not microwave safe.
So that's the reason for that.
Exactly.
And because these chemicals can really produce also cancer.
Oh, yes.
Yes. So that could be the rationale why sometimes putting food, hot food, for example, rice or anything, in a plastic container, is that safe?
Yeah, there's, I think one of the substances that was identified is dioxin.
Dioxin.
And there are certain, in fact, just intense heat exposure, not necessarily microwave, that you can produce this and ingest it and become and cause some cancers.
So if you take home some foods and you put them in this plastic, it could be a dangerous way?
Yes and no, because that theory, I mean, if you say that, then everybody's not going to put food in plastic and it's going to be banned. No?
Yes.
So the precaution is, in general, you avoid excessive heat, put it in, use the proper equipment when you put things in the microwave or when you store food in general.
Like, for example, in Sari store, those who have some turo foods there, no? Is it the same?
Yeah, because in some cases the plastic especially can elute some substances, and it can be transformed, etc.
So it's advisable maybe let the food cool down a little bit, right?
Perhaps,
or put
use
it in
better
containers.
In the case of colon cancer, Dr. Estrada mentioned that there are some lifestyle factors that could contribute to getting it. What about in breast cancer? Is there such a thing?
In general, when we talk about prevention of cancer or lifestyle, the lifestyle that's always told is that number one is to eat more vegetables and fruits in the diet.
Yes.
Number two is to adopt a physically an active lifestyle. As little as 30 to 45 minutes of brisk walking can satisfy that.
Every day.
Exercise.
Number three is limit weight gain. And number four, number four is avoid or limit alcohol consumption, if at all.
How about cigarettes?
So these
would
are
that affect?
Oh, cigarette has been already
proven
for the lungs, but
always
for
said
the others.
to not be taken, especially or not be done for lung cancer.
Yeah.
For other cancers, there are some reports or studies that will associate cigarette smoking and a particular type of cancer, but more so with lung cancer.
What about for breast cancer? Is there any
Yes,
lifestyle
also
factor
there
associated
are.
with it?
I mean, these are the general
Yes.
lifestyle factors. So, being sedentary, eating consumption of red
So it's
meat,
the same.
etc., increases your risk. Of course, not to the impact that a carcinogen, ingesting a carcinogen will do, or even if you have a very, very strong family history. So in general, we tell people to adopt a healthy lifestyle to try to prevent or lower your risk of developing any cancer.
You know, there's available in the market now tests in order to determine if you are prone to breast cancer or other forms of cancer. Can you comment on these, like what Angelina Jolie did,
Unfortunately, the first problem is that they're not as very accessible, these kinds of tests.
Expensive.
In fact, that test that Angelina Jolie just had was just off patent from the U.S. Supreme Court for a long time. And when Angelina Jolie did it, there was only one lab in the whole world which can do that. So it's inaccessible, expensive.
Extremely expensive.
And then the test is not, since it's patented and it's the only one lab does it, it cannot be validated by another lab, etc. So, and the science in identifying which part of your gene has a problem, if it's a problem itself, it's a mutation, or is it just a variation, it's not been exact yet. So we hopefully at some point in time or later on, we should have it more available, cheaper, and also more specific for Asians like us.
So until now, it's only this one laboratory in the whole world that could do the test.
Yeah, there are just a few, in the past few months, there have been other laboratories that have come up, but very few. And then, of course, since it's new, the tests have not been truly validated yet.
And the science behind the test, has it been proven beyond reasonable doubt that it works?
In certain cases, especially for Westerners or for Caucasians.
For Westerners.
But for Asians, since it's just starting, we don't have as much, especially here in the Philippines. Of course, not having the funding for research, we do not have enough data to say if these tests are applicable to us as well.
Nor is it foolproof, right? I mean, just Angelina Jolie, even though she had both her breasts removed, there's still a possibility. Some say that there's still some remnants.
We were just talking about it. Her risk went from 87% to 5%. So there's still a 5% risk.
My question is, if the science behind this hasn't been proven, then the statement that there is an 87% risk can still be doubted.
It is proven mostly in Caucasians now.
In Caucasians.
And if you do have that mutation, which Angelina Jolie did have, it's proven that her risk is 87%. However, if you do not find the mutation, for example, in an Asian woman, it doesn't mean she doesn't have that risk. Again, because the science is not clear for Filipina in general.
Because certainly Asians react differently.
And we have a different genetic
like
makeup. We
genetic.
may have different genetic makeup than Caucasians too.
Can I go to,
Yes,
I
Dr.
thought
Go
of
ahead.
some issue regarding the abdominal cancer, because when you open up the abdomen, then and eventually you get greeted by the appendix. Sometimes they just appear right there. Will you operate on it, remove it together with the cancer, or what? Even if it's not affected?
Well, the dictum I always say is, when I treat a patient, I do explain the spectrum of the disease with the patient and with the relatives. And in such instance that I just see that the appendix is smiling at me during the surgery,
so tempting.
I don't smile back at it. Because I feel that, number one is when you go in, you treat the main problem. So you treat the cancer. That's the first thing you have to do, is to treat the problem. Now, if the appendix is related to that problem, like it has spread into the appendix, or it is adherent, or it is attached to that cancer, definitely that has to be removed. The other factor that maybe I may remove the appendix is if the anatomy is already impaired, then I may probably remove that appendix. But otherwise, if the appendix is just smiling at me, then I don't have to smile back.
So you don't really remove it.
Yes.
To give a bonus surgery.
Yes.
Yes.
I will remove it if I think there should be a reason why you remove it. Of course, I've removed patients. I've seen or treated patients up to age 95 with appendicitis. But again, these are very rare. So we shouldn't
just remove
just remove anything because
without
of
any symptoms.
Yes.
I see. But you do colon surgery also likewise, Dr. Kono. What about this appendicitis? Because some seamen are afraid that they might develop appendicitis when they go to the sea, for many months. What is your advice to them? Because I heard that some practice of some surgeons, they remove the appendix.
Is to remove the appendix even without appendicitis,
as a
just
preventive
because
measure.
the patient is a seaman.
Yes.
It turns out it's really an ethical problem. Certainly, we understand that if the person develops a seaman develops appendicitis out in the sea, that person has to come for surgery. The problem with that is that if you remove the incidence of appendicitis, for example, in 1,000 seamen, is really not that high. So, in order to save maybe at least one, you may have to do 1,000 appendectomies before you're able to see one. And of course, there are complications from doing unnecessary surgery, something you don't need. The other point is that if you remove the appendix, why don't you remove the gallbladder as well? Why don't you remove part of the colon?
Why don't you remove the uterus? Because
for women, why don't you remove the uterus?
Just to prevent everything from happening.
And remove so-called unnecessary organs.
I think.
Father will be very happy to listen to you guys.
In some countries, they do advocate that. But in the Philippines, I don't think that's widely accepted.
But Sarah, if there is a policy in that particular recruiter and then or owner of a ship and then they demand it, what should the applicant do?
Well, there's you can always not obey or disobey the
but if
punishment.
they don't
that will
accept
cost
would
you a
that
job.
be discrimination
yes, but it
or
will
what?
cost you your job. You're right.
It might.
Yes, it can cause discrimination. If it's a condition for employment, then it becomes it becomes too much of a burden on the part of the seafarer.
Yeah.
If it becomes a condition for
And they will
employment.
not answer for the operation anyway, I think, or if there are complications, no?
Yes,
Or so.
It's just a condition.
That's the practice, eh.
That
That's
you
the,
should have
the
no
seafarer
appendix
has
on
to,
it.
as a preventive measure, because as you said, on the employer's part, they'll have to dock the ship and then send them to the hospital for for the appendectomy, etc.
Change their whole entire
Yes, the
schedule
course
just
of
for that.
the ship. So, although it's a preventive measure on the medical side, sabi nyo nga, no, if it's an unnecessary surgery, then and there's a
complication.
very vehement statement to make. Pero for legally, it's too much of a burden on the part of the seafarer. However, in reality, I think many comply with it. Nevertheless, it's like not an open secret, but an unspoken rule amongst many of our seafarers. It has to be changed by some policy.
I think it's not for the appendix, it's for the gallbladder. If the
Also,
patient has some stones in the gallbladder, then
He's
May
right.
history,
yeah, because what
Prone.
happens now
Prone
is
to-
they have an ultrasound as part of
yes.
as part of their
Physical
pre-employment,
Yes.
and because of this, then they once they see a stone, then
So they
they,
can
they,
demand
they are
that.
required to have that gallbladder removed. But for the
But-
appendix, no.
I suppose that's the right of the employer, no? These are just subjective things, and they just
Correct,
want
correct.
it.
I think
They
it
have-
has
they
to be a
have
good
the-
discussion between the patient and the surgeon
Mm-mm.
regarding why and this is going to be done, etc., and the risks, the benefits,
Yeah.
any other complications, and of course the cost.
And of course, if that's what the employer wants, no, he has the right to choose whoever
Yes,
one he
because
Is
wants.
it
it-
really
whether-
within
Work
the
with
rights of
them.
employers to demand something like that?
Well, to consider
possible.
whether that is discriminatory or not is debatable. So, unless there is a clear-cut legislation on it or a policy enacted by the DOL and the Seafarers Union, then so far it's allowed. So it's as I said, in reality, this condition exists, and in practice, it's being practiced. So unless there's a lobby for it or there's a clear-cut policy, then it will continue to prevail. This practice will continue to prevail.
As a matter of fact, in one of the questions presented to the applicant, they asked you if you have had any previous operations. Why is that so? Why is that so?
Well, obviously,
Is it because
for obvious reasons.
future
Yeah,
complications like
correct,
that?
correct. Now, there are certain conditions which can produce problems, and can be a problem when you go out for your work, and the work is like in the middle of the ocean or in the middle of the sea, so it will become a problem. So, and in any job or in any from college, when we enter college, we also put our medical history there. I think it's part of.
You need to disclose
Yeah,
it.
these are all things that you need to say.
I see, for whatever it's worth.
But
The-
if,
the
if
also-
you
the problem also is when it's also good that the employer know
Yeah.
that
Yeah.
medical history, because like if the patient develops abdominal pain on board and has had previous surgery, of course the first thing that probably might pop in the mind would be adhesions, which would be causing the abdominal pain.
Yeah, that's,
well, if that's the purpose, I suppose that's fine. But if those preconditions are used to discriminate against a person,
Then-
then I think that's something else.
Correct.
Yes, that
Agreed.
makes up. That will be a case for not even illegal disease, but discrimination prior to employment.
yeah, but in our constitution, they mentioned everything: race, color, no discrimination against
Yes,
race,
yeah,
color,
body parts.
religion, and on if you had previous operations.
The previous operations.
Yeah.
It's a part of the enumeration.
Yeah.
I see.
But when it comes to, although I'd like to address this question to our medical experts, how about before you do surgery, to what extent does the family have to be involved prior to performing, or prior to the patient, approving or agreeing to go
And
under
adding
the
to that,
knife?
I want to know do you tell outright the patient that he has this possible colon cancer?
Oh,
Or do you tell the next of kin first? No? Something like that.
Yeah, who do you tell? I would think the patient, but in your case, in the cases that you've handled, doctors, do you disclose first to the patient or to the family member who brought the patient to you?
Who wants to answer first?
It's always the right of the patient to
That's
know.
correct.
And so, if the patient has a problem and the patient comes to you, we are not only obligated, it's mandated that we tell the patient and discuss with the patient again, we call it regarding the risks, the benefits, the possible complications of any management options that you recommend. It's the right of the patient to know. And it is only the patient who can give you that authority or that consent to do whatever treatment you will do on the patient. The family actually may not have that. We cannot get the consent unless the patient is not in his right faculties or in an emergency. But in general, it's the patient's right to know. In cancer, generally, we have a little more time to deal with this issue and to discuss it rather than in an emergency situation. So in general, we are able to disclose this now. However, there are some patients' family members who will come and ask, Doctor, can we not tell the patient?
Okay.
Then we have to, on the other hand, we have to respect that. I always tell my patients that the patient has the right to know. We can talk about it. We can talk about the options for treatment, and the patient does have a right to know later on. But if you do not want, it is upon you. But the best person generally to disclose it would be, and to give you the options, would be the doctor. I will respect the families and the relatives' desire not to disclose to the patient. But when the patient comes, we cannot lie, and we can only we must disclose.
But do you have to say outright that you have cancer, something like that, or do you do it piecemeal?
It depends on the psyche of the patient, and that's the reason why medicine is an art and a science. Yeah. You don't have one formula for each. Each patient is different, and you have to treat them differently. Means to say you don't have to blurt out and you say you have cancer. You have a couple of months to go. It's not the way to kill the patient more. It's
you hasten the death.
Yes, you hasten
the death, right?
So I think the way you explain things is how you see the patient's psyche. Eventually, you will have to tell the patient if what condition he has. It might not. It will also depend on his intelligence, because if you're talking to an individual who has a very low IQ, then he will not understand it. So you have to explain this. So this is part of the counseling. This is part of the preoperative and postoperative counseling.
Any legal comments?
Well, sabi ni doctor ko, the patient has absolute rights over his or her body.
Yeah.
So, kung they can choose what can be done, do it. Pero nga, may exceptions, like when they're not in the right mind, they do not have the capacity to consent or the capacity to decide for themselves. No? But I think culturally, I guess, sometimes, because like in my experience, I have an office mate whose husband doesn't want to undergo merong colon cancer, doc, and then the husband doesn't want to undergo surgery. Mas takot siya sa surgery kaysa mamatay. Yun ang nasa isip niya, I'd rather die than go through surgery. And in the previous episodes we discussed, it's not the doctor's job to convince the patient to undergo a certain operation. However, it helps if you talk to another patient who's had a similar, experience. Pero ang weird mas takot siyang mas takot siya sa surgery kaysa although he was already faced with.
Kaya
iba nga takot pa lang sa injection pa lang Diba?
What is the average lifespan of a colon CA and of a breast CA as far as your experience?
It depends on the stage.
Yeah.
Depends on the stage.
It
depends on the cure that was done. If you cure if the patient is cured, then the lifespan is not altered. In fact, you go through the normal
proper
lifespan.
timing lang, no?
What about in colon cancer?
For colon, as I said, the general life expectancy is around 50 to 60%. That means to say that's from stage 1 to stage 4. So if it's a stage 1, we're talking of 9.
Untreated. No? This is untreated.
Well, for untreated, then they'll eventually die from it.
Yeah, but how long would it take to spread from 1 to 4? But like, for example, in cancer of the cervix, you can stay in stage 0 or 1 for 10 years or so.
We always say that it depends on the tumor biology.
Yes.
It depends on what kind of tumor you have. Some people have more aggressive, that means faster.
Multiply so fast.
Right.
Then
Some naman, you will see patients progress to stage 1 to 4 years before it happens. So may ganun.
the other thing we look at is, well, the older they are, they're usually less aggressive. The tumors are less aggressive because this is again a general rule. You know, not everybody has this, but the younger the patient has the cancer, they're basically more aggressive.
Okay. Well, we've reached the end of our show, so maybe you can have a few words of parting from Attorney Sara.
Medical Dilemma is already approaching our second season, so keep watching Medical Dilemma, and of course, thank you to our guest today for enlightening us.
Yes, Dr. Ko?
Well, congratulations and thank you for inviting us.
Thank you so much.
And to remind people to, anytime they have a suspicion of cancer in any part of the body, go visit your doctor.
Okay. Dr. Estrada?
Well, I'd like to thank the show for inviting me.
Very welcome, Doctor.
To share our expertise here. And I'd just like to tell the public that everybody is prone to develop these cancers. So screening is very important. And knowing when to have this done, please see your respective physicians.
Okay. Dr. Sanchez?
As I said, no one is immune from cancer. Everybody can have it at one stage or another. So the best is really to have regular executive checkups if
Even
possible.
the doctors.
Because kahit na kompletong check-up po, pwede ka pa rin matapos.
Okay, so it is very difficult to know if and when one would contract cancer, the dreaded disease. All we can do is to maintain a healthy lifestyle, get regular checkups, and of course, keep a positive state of mind always. Thank you for watching Medical Dilemma. Catch us again next week here on GNN Sunday, 6 p.m. You can also watch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you.
Medical Dilemma